Put an end to heel pain. It says right here on your poster, Shockwave therapy now available at Allied Foot Specialists. What's that all about?
Allied Foot Specialists is a company that Dr. Green and I started a couple of years ago, where we have offices basically throughout the Lower Mainland, and we've been trying to, one of our mandates is trying to promote new techniques in podiatric health and surgery, and Shockwave is one of them. What it is a opportunity for the patients to have a non-surgical approach to chronic heel pain. And usually one of the main causes for heel pain is plantar fasciitis. We spoke about that earlier. What it is a band of tissue that connects on the bottom of the feet and spreads out to basically the ball of the foot. And it actually tears away from the bone, little micro tears away from the bone, which are quite disabling.
Yes.
At nighttime when you sleep, the fascia contracts up quite nicely, and when you step down on it again, the first steps in the morning, it really, pulls and starts to tear again. This repetitive strain back and forth on the fascia causes a disabling problem called plantar fasciitis. Mostly we treat this with orthotics. There's other conservative means or supportive care like non-steroidal anti-inflammatory medication, Advil, ibuprofen, that kind of thing, and maybe some prescription medication, physiotherapy, splinting, and those kind of things, cortisone injections. But if it doesn't respond, then the patient is often faced with surgery, which takes some time away from their life to heal and this kind of thing. Shockwave therapy is kind of where we slip in before surgery, and what we do is we use a very sophisticated ultrasound machine that is taken with pneumatic energy and kind of shot, if you will, into the area of concern. There's no electricity involved. People often think shock, electricity. There's no electricity.
My brain will stop or something. No, it's not a lobotomy.
Not at all.
No.
It's safe. It's non-invasive. There's no anesthesia required, and it doesn't really hurt at all.
It's an ultrasound.
It's an ultrasound, but again, it's radial shockwave. So what happens is we actually take this ultrasound and we kind of force it in with pneumatic energy. So you hear kind of like, almost like a jackhammer, like a like a tapping type of thing when it goes in the area. And we use it for plantar fasciitis, and we also use it for Achilles tendonitis and other musculoskeletal problems in the foot.
Does it hurt?
No, very, very little. Some people find it a little bit uncomfortable initially till they get used to it. Often the little area that we're working on gets anesthetized quite quickly. There's few to any side effects with it. We have had some bruising in the area a little bit, but the patient usually walks out feeling much better than when they walked in, and we're having about 50% relief of symptoms right after the first treatment, so we're very encouraged.
And how many treatments do you normally need? I guess it depends on the severity.
It does. I think it does.